Good morning, everyone. We've just started recording, so we can go to the first slide, please, Candice. Thank you. Thanks very much, everyone, for joining us today for our third and final webinar series. My name is Joanne Duncan, and I'm joined on the call today by my colleague, Candice Aitken. So we can go to the first slide, please, Candice. Thank you. So thanks to everyone who has attended and contributed to the first two webinars. The engagement from the sector has been really great, and I hope that you've found these helpful so far. The recordings from the webinars are available on our Safe Staffing Hub page, so please do share these with colleagues as we approach the enactment date in April. So in our series so far, we have provided a brief introduction to the Act in week 1, and we took a closer look at the main principles from part 1 of the Act during our second webinar. Today, we are going to review part 3 and we'll have our Q&A session. So thanks to everyone who has submitted questions using the Microsoft form link that we've been sharing during the first two webinars. So we'll share these questions with you and provide a response to those at the end of today's session. Next slide, please, Candice. Thank you. So just to recap, the current legislation that covers staffing is Regulation 15 of the Scottish Statutory Instruments. You might know these as the SSIs. It's a small paragraph in the instruments which details how providers must have regard to the size and nature of the care service when arranging staffing and ensuring that there are at all times suitably qualified people working in the service. Now, like we've said, the asks of this current regulation are all still present in the new Act. The new Act just goes into more detail, and there's that focus on the recognition that, as we all know and appreciate, high quality staff provide high quality services. Now, the current expectation is when the Health and Care Staffing Scotland Act comes into place in April, this piece of legislation on the screen will be revoked. Can I just check we've all got our cameras off, please, just so it doesn't interfere with the recording? That would be great. And we'll open up the mics at the end for anybody that wants to come in for the Q&A session. Thank you. Next slide, please. I'm just going to try and mute somebody there. There we go. Sorry about that. I've just muted you. Sorry, it was just to interfere with the recording. So thank you. We're moving on to reviewing part 3 of the Act, and part 3 starts at section 7 within the legislation, which is the duty on care service providers to ensure appropriate staffing. Now, this means that providers must ensure there are suitably qualified and competent staff working in the service in numbers that are appropriate for the health and well-being of children, and to ensure the provision of safe and high quality care, back to those guiding principles of the Act. The new legislation does not impose different staffing levels, and the minimum ratios that are given to services at the point of registration or variation will remain the same. These ratios are a minimum standard, and services still need to consider how you're arranging your staffing whilst fully considering children's individual needs. And it's section 7 of the Act that details how you should determine what constitutes appropriate staffing levels by considering the nature of the care service, so the kind of service that you're providing, the size of care service, the aims and objectives you're working to, and the number of people experiencing care, and then the needs of those individual children. Next slide, please, Candice. Thank you. So still within part 3 of the Act, section 8 is about staff training. So the Act states that providers must ensure staff working in the care service receive appropriate training for the work they are being asked to undertake, and that they receive suitable assistance for the purpose of obtaining further qualifications that are appropriate to their work. Now, the important element here is qualification important to their work. And this is already in legislation that we're working with at the moment, and refers to ensuring that staff receive appropriate training in order to achieve those guiding principles of the Act again, of being able to provide safe and high quality care and ensuring the best care outcomes for children. When we're reviewing staff training, we would be having discussions to determine how staff training needs are identified. So you will already have certain processes in place where you'll be looking specifically at training requirements. So this may be during staff appraisals or as part of your self-evaluation or quality assurance processes. We spoke a lot about culture during our second webinar, and this threads through to this section as well, by considering how the culture within your service supports staff to reflect on their learning and adopt any new processes or practice, with a view to enhancing children's experiences or outcomes in order to ultimately influence continuous improvement. So we move on to the next slide, please. So we heard some great examples last week about practice in the sector which would meet the requirements of sections within part 1 of the Act. So if you did miss that, please do go back and have a look at that. So we wanted to give you the opportunity to share some good practice again for this part of the Act. So if we can have a think about staff training in your services, and it'd be great to hear how you're measuring the impact of staff training and how you know training is contributing to improvements in practice. So for anybody that has missed our first 2 webinars, my apologies, I haven't explained the QR process. On the screen, you'll find a QR code, and if you scan the QR code, that will allow you to contribute, like you can see people are doing on the screen just now. I think Candice is going to pop a link in the chat for anybody that doesn't have access to the QR code, and they can open that in another window. So thanks, these are flooding in. So there's room monitoring going on, pre and post questionnaires. So that's allowing you to measure the impact of the training before they go in the training and afterwards. That's good ideas. Staff training folders, and that will be a really good way to allow that sharing of training and to make sure that everybody's impacted positively by the training experiences. Get people off the floor. So it's a great way of allowing that training and that knowledge to be spread a bit wider. That's a good idea. The Lupin scale of engagement I saw there, so peer observations, CPD files, appraisals. So you're doing Microsoft Forms. I think that's maybe if you're thinking about doing some questionnaires or using Microsoft Forms. One-to-ones, so is that perhaps one-to-one specifically related to the training and how you're going to implement any new learning? Is that maybe what that is about? Absolutely, discussions with staff. It does come down to that, discussions with staff, doesn't it? Challenge questions, that's a nice one. I saw that work in a service really well. And that really supports staff to give them the autonomy to think as well about how their training is going to impact and help them understand what is underpinning their practice. Quality assurance audits in partnership with the local authority. Yeah. Feedback at staff meetings. So you're allowing staff that opportunity to come into staff meetings and share their training. That's another really good way of doing this. So hopefully you'll be able to see some ideas and you can maybe take some of these ideas back into your service. More about staff feedback, supervisions and training folders. Ask what their takeaway from the training was and how it made them feel. That's a really important one as well. And that would be supporting staff wellbeing. Remember back to last week about Principle 5. Staff observations, supervision, staff growth and confidence and leadership skills, communications and observations. And actually we spoke a lot about that last week, about that leadership skill and how some staff are really motivated by that opportunity, which again has a positive impact on improving standards and outcomes for children, Principle 1, and staff wellbeing, which is Principle 5. So you can see how these are interlinked here. Staff knowledge and skills, staff engagement with recognising their own skills development. And we spoke about that last week as well. I think we directed you to the EESC information about skills development and to support with that identification of needs for staff. Confidence, yeah, absolutely. So we spoke a lot about confidence last week as well when we were thinking about staff wellbeing and how confident they feel to carry out the roles that are expected of them. And this does come down to staff training and make sure we're measuring that impact. So these are all things that we would be looking for when we're having discussions, and it's evident that you already have a lot of this information within your services and team meetings and room flow books for staff to record the impact of training, including comments and photos, etc. And that's a lovely way to really support that engagement with families as well and carers, so you can share that information about the learning and how you're developing your staff team in order to improve those overall outcomes for children in your service. So that's great. Candice, feel free to jump in if there's any that I have missed. I know we've got 4 pages now, so thank you so much for these contributions.
Thank you, Joanne. Just a few that's come on the chat. So a few people have mentioned one-to-ones, which you have touched on, and distribution leadership. Again, you're building that confidence and that ability within your staff team, but also peer evaluations, which I think is a fantastic one for coming back in after training, implementing that, and then really seeing the impact and how that's affecting your colleagues and influencing their training and developments as well.
Great, thanks, Candice. And I've just read a comment there, and it's now making me think about staff training. It's not always about going out of the service and undertaking training. Sometimes that's about identifying best practice documents and how you're going to incorporate them into your service and having those discussions about best practice documents and what that means for your service. It's not always about that formal identification of training and qualifications. Sometimes it is that sharing of best practice, which can come from other setting visits, for example, training journals, staff bringing back to the meeting. So thanks so much for all of those contributions. These will all be captured, of course, on the recording, so you can go back and have a look over these. So can you just go to the next slide, please, Candice? So thanks very much for all of your comments. Like we've identified, there's some great work underway in the sector, and it really has been a privilege to facilitate these conversations and provide a platform for these to be shared so widely during the webinar series. So thanks very much for all of your contributions of sharing this good practice over the webinars. Please do, like I've said, go back and view them if you've missed any. So the slide on the screen just now brings both of those sections that we've discussed together. So that was section 7, the duty on service providers, and section 8, staff training, and these are both of part 3 of the Act. This slide demonstrates the similarities between the current Regulation 15 and the new legislation. So we've got wording from Regulation 15, that's what you're regulated against at the moment, on the left-hand side of the table, and wording from the new Act, the Health and Care Staff Scotland Act, on the right-hand side of the table. So the duty on care services to ensure appropriate staffing by considering the nature and size of the service already feature in current legislation, as do the considerations of your aims and objectives and the number and needs of children. The requirement to ensure there are suitably qualified staff who receive appropriate training can be seen in Regulation 15 on the left. So the information we discussed for section 8 about staff training is already being considered with current legislation. So to fulfil current requirements like we've talked about, we already ask providers during inspection about induction plans and checking the regularity of scheduled supervisions or appraisal systems. And you all have other ideas that you'll be showing us when it is time for inspection. And this all allows providers and managers to assess, monitor and plan the appropriate needs for individual staff with a view to improving those outcomes for children. So this shows the ask in the new Act about staff receiving appropriate training for the work they are to perform and being assisted to ensure their professional learning is current is not a new ask. The similarities between the current legislation of Regulation 15 and Part 3 of the new Act are evident. The wording is a little bit different, but in general, the ask of Part 3 of the new legislation does not differ much from Regulation 15, with the exception of the wellbeing of staff. And this is detailed in Section 7, and it's the wellbeing of staff insofar as it affects the health and wellbeing of children and the provision of safe and high quality care. And we spoke a lot about the wellbeing of staff during last week's webinar, webinar 2, where we looked at the main principles, and number 5, the wellbeing of staff is covered there. So if you could just go to the next slide, please, Candice. Thanks. Can I just ask everybody to pop mute on just now, please? Thanks very much. I just wanted to briefly mention Section 9 within Part 3, and this details the responsibilities regarding reporting. These reporting duties are for the Scottish ministers, and they must state that they should be publishing and laying before Parliament a report that sets out how the duties imposed by the Act have been met and the effect that staffing levels have on this. The report should be presented as soon as is reasonably possible following the end of the financial year. And there isn't a specific deadline set for this, but the Scottish Government have a view that this should be completed by the 30th of April each year. So the first report will be expected by the 30th of April 2025. The report compiled by the Scottish Ministers will be based on individual findings from local authority and integration authority reports, which we expect will summarise how the guiding principles are being fulfilled and the effect staffing levels are having on services being able to fulfil those duties laid out in the Act. Another element of this report to Parliament should set out how these matters will be taken into account in determining future supply of care professionals and the steps that the Ministers have taken to support staffing levels in order to assist with the duties of the Act. Now, I've used wording such as "we expect" when I've been discussing that, and that's because the information we're covering as part of this webinar series is to share with you sections within the Act that involve the social care sector. We won't know until after the enactment of the legislation any further details of this. The Scottish Government have advised that they will produce a report template for local authorities and integration organisations to complete when publishing this information, and we expect this to be shared directly with those authorities involved. Now, I appreciate that's a lot of information to digest, and I've only touched on it, so you might now be considering your role and responsibility regarding this. However, the Scottish Government have suggested there will be no changes required to commissioning contracts, and they will issue further details of how the information will be gathered after enactment. Go on to the next slide. Thank you. So that brings us to the end of part 3. That is the shortest part of the Act and very similar to the expectations already at your meeting, with some slight changes at best. So the next few slides are questions that have been sent to us, and we've tried our best to group the questions that we were asked to provide a response to these. You will have an opportunity, once we've seen all submitted questions, to take part in our Q&A questions. So if we can go on to the next slide, please, Candice, and we'll show you the first group of questions. So these questions were about changes specifically, and what changes the legislation imposed. So this legislation is not seeking innovative or new models of staffing. Its aim is to support decision-making and flexibility. Its purpose is also to promote transparency in staffing and support that open and honest culture where staff are engaged in processes that affect staffing levels and that they're kept informed about decisions to those levels. This Act is for all health and social care services, so this hasn't been introduced specifically for our sector, and we're hopeful that this webinar series has highlighted all of the great work underway in the sector, and many of the asks of this legislation is what services are already aiming for as good practice. The difference now is areas that we classed as good practice, such as staff wellbeing, are now more than best practice aspirations. The requirements to consider these are legislative. So go on to the next slide, please. Thank you. So the questions that we've grouped together are on the screen here. And this Act is specifically asking for the principles of the Act, including number 5, which is ensuring the wellbeing of staff, to be read in context of achieving the overarching outcome of the Act, which is to enable safe and high quality services and ensure the best care outcomes for people who use services. So this can't be prescriptive because everyone is different. Inspectors will be engaging in discussions with staff, as we do already, to determine how supported staff feel in order to carry out their roles and to contribute towards that safe and high quality service, and then to enable them to ensure the best care outcomes for children, back to the guiding principles. So this might be about their involvement and understanding of risk assessments, for example, that are in place. How confident do they feel with mitigating risks? We may also view this in the context of induction plans that we spoke about last week to determine how supported staff are to understand what's expected of them. This principle is about the culture and services and creating environments where staff are able to raise issues about the safety of children or supported to raise any areas of concern. You're aiming for a culture of transparency, continuous improvement and open communication, which will support staff's well-being insofar as it affects their ability to provide safe and promote the health, well-being and safety of children. For more specific supports available online that you might want to review, there is the Early Years Scotland Wellbeing Hub and the EEC National Wellbeing Hub. I did ask advice from other colleagues within the Safe Starting programme for any resources that they have come across during their research for the legislation, and they have also recommended Able Futures Mental Health Support Service, who I went on and had a quick look, and I understand that they are offering 9 months free advice and guidance from mental health specialists at the moment. And another one recommended to me was See Me in Work, who offer support to employers to make sustained changes to organisations. We will be producing a series of quick guides to help all services understand their responsibilities towards the Act, and one of those will be staff wellbeing. So please do look out for the quick guides that will be available on our hub page when they are ready for publication. Next slide, please. So these questions were about how you know you are meeting the expectations of the Act, which we've grouped with questions about documentation and policies. We've mentioned in the first and second webinar information about the statutory guidance, which has been written by the Scottish Ministers to support services to apply the legislation. And these can be used to determine the outlining expectations of each principle that should be considered holistically, that we covered last week. So these can be used and included as part of your self-evaluation to quality assurance processes to answer those how questions. How are we doing? How do we know? And what do we plan to do next? In terms of how we will move forward when the legislation is enacted, this will look similar as how we currently use other legislation for regulatory purposes. So every registered care service must continuously meet the requirements of a number of acts of legislation, including the Public Services Reform Scotland Act and the Social Care and Social Work Improvement Scotland Regulations 2011, which are those Scottish statutory instruments, the SSIs. So under these frameworks, you'll already have policies and procedures in place that you discussed at registration or during your most recent inspection. We'll continue to request that policies and procedures should reflect best practice guidelines, and by regularly reviewing these and updating these. For example, one mandatory policy we request is a recruitment policy, so I would expect a number of your policies already in place will cover elements of this. Policies and procedures do promote consistent approaches and understanding. So if you feel the introduction of this Act requires an update of your policies, then that would be one way of ensuring that staff understand how the new legislation underpins the practice. We don't request individual policies for each provision of the statutory instruments, because you'll find that these are woven through a number of service policies and procedures that you'll have, and this legislation is the same. Legislation underpins your practice and sets out requirements that service providers must follow. So, for example, if we go back to the SSIs, Regulation 5 states that people must have a plan which sets out how their welfare and safety needs are met. You'll have a policy regarding personal planning, will cover this. Regulation 4 identifies how providers must support the welfare of people. However, whilst there's a variety of best practice documents and guidance to support this regulation, we would use legislation to ensure people's welfare is safeguarded in terms of preventative approaches. And this will be assessed in a number of ways, including risk assessments, staff practice, staff knowledge. There's a number of ways that would be documented in your policy and procedures. Next slide, please. So these questions are asking specifically about evidence. One question here is related to floor books. So if floor books are the approaches that you already use, then absolutely, we would consider this along with our evidence requests. The important thing about any evidence is that it's there to support and promote children's outcomes. In terms of producing evidence, we'll continue to be proportionate with our evidence requests and reviews. And again, any evidence requested should be to add to our assessment of the outcomes for children. So this will include discussions with staff, reviewing certain paperwork, perhaps accidents and incident forms that were looked at, So when we're thinking about staff's involvement with these, we're asking staff how confident they would be with the processes or the completion of the accident incident forms, for example, and then how you're using such forms to identify trends and exploring whether staffing has an impact on those trends. In terms of sharing knowledge about the Act, it is important that all staff understand the principles which underpin the practice, which is why we have developed a number of resources to support staff to understand their role in the Act, such as our poster that's available on the Hub page, a number of other resources that are available on the Hub page, including bite-sized videos for the two parts of the Act that are applicable for practitioners, and of course the recordings from these webinars will be available on the Hub. There's a comment there seeking advice to support with recording evidence. So we would recommend the self-evaluation for improvement guide that is available on our Hub. And this guide helps services to understand how they can evaluate services by identifying what's working well, and provides questions that might help you identify your service's strengths. And this will hopefully help you make a start to documenting the observations and discussions that you're talking about here that you're already. Yes. Next. Thank you. So this slide grouped together some questions regarding ratios and supporting children's needs. So we covered ratios when discussing section 7 of part 3 today, that the new legislation does not impose different staffing levels and the minimum ratios given to services at the point of registration or the ratio will remain the same. The current legislation in relation to staffing, Regulation 15 from the Scottish Statutory Instruments, SSIs, already ask providers to ensure that there are suitably qualified and competent people working in the service in such numbers that are appropriate for the health, welfare and safety of service users. It will continue to be the provider's responsibility to ensure that children's individual needs are being met, and the statutory guidance which accompanies the Act matches the message from the Health and Social Care Standards, which states that care can be high quality if it provides support or services that are right for the individual, taking into account their own particular characteristics, according in the statutory guidance. We are very aware of the difficulties facing the sector right now, and our inspections must continue to be focused on children's outcomes. So if you feel you don't have the required resources available to provide high quality care-based care outcomes for children, it's your responsibility to determine next steps. And that's not always about seeking additional staff. There are a number of steps that can be considered first. So you'll be looking at the experience of staff within the room, evaluating the skills mix within the room, reviewing staff training that we've spoken about today, or the mix of children in the room. And this can also take us back to the aspects of the wellbeing indicators, which in some cases will support the identification of needs. And we can use the GIRFEC 5 key questions if this would support in this area as well. So this highlights the importance of ensuring all who are involved in the provision of care for children are involved in that personal planning to identify what matters to that individual in order to identify how you'll support them to meet their personal outcomes. So if these processes identify further support is required, then you will need to engage in discussions with the provider on said teams. There's a question there about supporting children's lunches. So I'd recommend reviewing the recent practice notes. They are available on our Hub page and were released last year. One of the practice notes is to support positive mealtime experiences. I think it is called Keeping Children Safe, Supporting Positive Mealtime Experiences in ELC. I think it's a long wording, but we'll pop a link at the end of today's webinar to that section of the Hub page, just for ease of reference. Next slide. So that brings us to the end of the questions that were submitted. Thanks again to everyone who sent in their questions. We'll now open up the meeting and invite anyone in who would like to ask a question to provide clarification on anything that's been shared during the webinar series, or to provide any further clarification on the legislation. So please use the hand function and invite them individually into the meeting. Following this, Q&A session, we'll share our final information, send on some links. So please do stay with us for a little longer. So thanks very much. Just over here, and I'll bring people in individually. So thanks very much for using the hand function. So Kath, if you would like to come in, Kath, you can unmute yourself if that's possible.
Hi, can you hear me?
I can, thanks. Hi, Kath.
Yeah, I just wanted to clarify that staffing ratios with children are currently given to us, obviously, by our inspectors and our registration document. Is that going to remain, or is it going to be down to the individual needs of each individual setting to decide on the ratios and staffing levels?
So the ratios that are currently given will remain the same, and they're a minimum ratio. When we're thinking about staffing levels, that's the staffing levels across the setting. So thinking about the individual skills mix of staff, when you're thinking about your staff deployment, that is down to the autonomy of the service to think about staff deployment and what meets the individual needs of children. But the minimum staffing ratios will remain the same.
Right, thank you very much.
Thanks, Kath. Just wait to see if anybody else would like to come in and ask a question. Oh, thank you. Able Futures are great. Somebody's currently using them. So that's the case for us in advance then. So we've got Terry, please. Terry, if you would like to come in.
Yeah, I just wanted to check, was it Able? I got Able and See Me at Work, but what was the rest of the company for that? Was it Able Futures, did you say?
Yes, and we spoke about the SSSE Wellbeing Hub and the Early Years Scotland Wellbeing Hub.
The SSSE Wellbeing Hub. And what was the last one, the Care Inspector? I think I've done that one now.
It's the Early Years Scotland Wellbeing Hub.
Thank you so much. Get their names. Thank you.
Thanks, Terry. And Caroline, would you like to?
I think Kath might have put her hand up a second time, Joanne. I don't know if she has another question.
Oh, thank you, Candice.
It's just worth checking.
Come back in.
Hi, no, sorry, I didn't put my hand up again, sorry.
Okay, thanks. Caroline, would you like to come in?
Yeah, sorry, it was just to say my question was the exact same as Kath's about wellbeing for staff and kind of signposting, so thank you.
Thanks very much. So I'm just going to have a quick look at the chat. It's difficult right now. We can absolutely appreciate that. We have lots of supports in place to support staff's wellbeing. That's great to hear. The face-to-face sessions, are they going to be the same as webinars? Is it worth attending if you have attended sessions? So the face-to-face sessions are going to be sharing the same information. So we're sharing the same information in a number of different ways. And the face-to-face sessions are going to involve a lot of workshops. So you'll be able to come along and meet with other colleagues that you perhaps are engaged with in the past across the sector, to share some ideas about the main principles. And as we can see the difference.
Oh, I apologise, that was a mistake. I'll just put the AHA slides back.
No problem, thank you. So yeah, so please do come along to the face-to-face sessions if you can, if you want to share some ideas of best practice, main principles. It will be very similar information that we're sharing. You have lots of documented posters, but it's difficult to find the act as a whole document. Okay, we will, I think there's a link on the hub page actually for the legislation in its entirety, but I'll be able to have a quick search now. I do have it saved, and I'll pop a link in the chat, so thanks very much for mentioning that. Will there be more sessions offered in different areas? At the moment, the regional events are set, and we're not sure if there's going to be any extension to that. We are a commissions programme. The commission for this programme finishes at the end of March before the enactment date, so we're unsure if we're going to have any further capacity to put in any other events. If we do, we will keep the sector well informed through our normal channels. I'll put that information in the page. Just going to see if any the same house. So I'm just going to search for legislation now and put a link in the chat.
Joanne, Lisa's put a link in the chat for everybody. Thank you,
Oh,
Lisa.
thank you so much, Lisa. That was really great of you. Thank you.
That's what I was looking for when my screen changed, so I apologize. It jumped up onto the wrong screen.
No problem. That was really helpful. Thank you.
Someone asked about, Joanne, where on the hub page will they find the webinar and the link? So I'll just explain. If you go onto the ELC Safe Staffing Hub page, which I'll put a link in at the end, there is a tab that says webinars. And if you click that open, it's the full recording and the PDF of all the slides that were on over the last 3 webinars.
So there's not going to be any other question. Well, there's one just popped up in the chat. Bear with me. Is there a direct link to the TURAS for the knowledge and skills framework that all staff have to complete? I've had a look and a few things come up. I'm not sure which one is correct. Okay, so we can share a link to register for the TURAS account, but just to clarify that training is not mandatory for all staff. Staff do not have to complete that training. There will be some information coming out and provider updates about the knowledge and skills framework. So please look out for that. If it is more accessible for your staff to develop their knowledge and understanding by viewing bite-sized videos or the information on our hub page, then please direct them to the hub page for that. I understand there were questions included in the annual return about the knowledge and skills framework, so please accept our apologies and just take this as clarification. The resource has been delayed and it isn't yet complete. Our partners at NHS Education Scotland and Healthcare Improvement Scotland are working to complete this now. The annual return questions were included to collect that baseline information about the usefulness of the resource to the social care sector. And we will not expect staff or services to have completed the learning resource at this time, so the knowledge and skills framework is not mandatory. So like I said, please visit the ELC section of the Safe Staffing Hub page for further information about support time services to prepare for. That adds some clarification there. Will you be able to print out the slides? Yes, they are going to be available. They are available underneath each recording as a PDF document, so you'll be able to print those out as well. So there's not a set, there's a question here about the hours of training that's needed. There's not a set amount of hours needed. It's whatever is useful for your staff to support their knowledge development of understanding the legislation, which is why we've done a variety of different ways. So there's bite-sized sessions like we've mentioned that are only 6 minutes long, or if they would like to view the webinar series, that's why we've recorded them. So please, whatever suit needs staff. And we're going to put a link to the recordings as well. Somebody else has mentioned that. Okay. So I think that's all the questions, unless anybody else. I don't see any other hands up. Yeah, there's more people asking for a link to the bite-sized videos. So the bite-sized videos are on the ELC Hub page under the specialism of ELC, either daycare of children or childminders. So we're going to pop a link into the chat in a second. So Candice, if there's no further questions coming through, just put up the next slide, please. So before we share our final links, we'd be really grateful if you could answer the question on the screen. I've mentioned there we are a commission programme for the Scottish Government, so we are measuring the impact of the work that we're undertaking. So we'd be really grateful if you could let us know if you feel that you're ready for the implementation of the Health and Care Staff in Scotland Act. Thank you. I see a lot of people. You're feeling somewhat ready. That's fantastic to hear. And there's some people feeling completely ready. So I'm really pleased that you feel confident now and ready for the enactment of the legislation in April. Thank you for the positive feedback there in the chat. I didn't get a chance to see it all. So we've just got another couple of slides. Please continue to bear with us. Thank you. So the penultimate question, please let us know if the series has improved or refreshed your learning on the impact of staffing? See some submissions coming in now and there. Just that's great. Thank you so much. I really do appreciate you supporting us with the data gathering. It will really help us reflect on the series as well as part of our own self-evaluation. So if you can just go on to the next slide, please, Candice. Promise we're nearly there. Thanks for sticking by us. So our final question, and this is specifically for our self-evaluations, can you please advise us what worked well during the series? And please do share if you have any ideas that would improve the learning experience for you. Just give everybody a minute to fill that in, and then we'll share that final slide and the links that we've been discussing. So thanks very much for submitting those responses. We'll just give that another couple of seconds. See people are starting. Thank you so much.
I'll also say if anybody, because we've come to the end of the session, if you're not able to access the AHA slides, please put your comments, answer the questions in the chat, and I'll be able to put it onto the form for you after the session. Thank you.
Excellent. So just while people are finishing typing, a final thank you to everyone who has attended the webinar series. The positive engagement has been fantastic, and thanks for being so open about the great practice that is underway in your services. So we're going to put a link in the chat now to our hub page, and that's also the QR code that is on the screen here. And we're going to put a link in the chat for the practice notes that we referred to earlier as well. And we were speaking about the mealtime one, so we'll put a direct link, but they are available to find on the hub page. Please do share this hub link with your colleagues and encourage them to engage with resources on the hub. So we've spoken about these a lot, the bite-sized videos, the supporting guidance documents, and of course the recording of this webinar series. So thanks again for everybody for your engagement. It's been a privilege to facilitate these conversations, so enjoy the rest of your day. Thanks very much.
Joanne, I wonder if it'll be helpful if I quickly stop sharing and then open up our hub page and show everybody where they can find that, because there seems to be a few questions.
That would be a good idea, thank you.
Just give me a quick moment to find it.
Somebody's asking if the slides can be emailed out. Due to such a high volume on the call, we can't email them individually, but they are available on our hub page. So when Candice opens up the hub page here, we'll be able to show you directly where you can find them. The slides and the recording from webinar 1 and 2 are already up, so we'll be able to demonstrate that. And then that's where you'll find the ones for today's session.
Thank you, Joanne. So this is the ELC hub page. The link is in the chat and also the QR code as well. So if you just scroll down here, that's where you can download the poster, find the information. This is where you can find the bite-sized videos. They're quite short. These are the links that take you to the PDF for the statutory guidance that's linked to each principle. Just let that open up. Some useful documents. Going back into the hub page. Here are the webinars. You just open it up. It has the full video and then the presentation slides that will open up into a PDF for you as well. So I hope you found that helpful to be able to access that information.
Thanks, Candice. So thank you again. That's the end of our Cs. Enjoy your day. See you all soon. Thank you.